Accra Psychiatric Hospital is still living on donations from benevolent organizations and individuals.
They say the facility stopped admitting patients for lack of funds. A 4.1 million debt to suppliers remain unpaid. When a news team visited the hospital Wednesday morning, we were told food for the inmates would not last till Sunday. A member of the communication unit of the hospital, Edwina Ankomase, was thankful to donors but appealed for support to pay the debt.
Now we would need more perishables like tomatoes, pepper, all those perishable things, and then if possible, some form of protein for them. We really appreciate what people have been giving us, but we would also need more of these things.
She added that the staff of the hospital sometimes support to take care of inmates.
The staff is really helping. Although there's none, the little we have, everybody makes sure that everybody has a little bit of it, and then we add up and to see how best we can help.
The hospital is still not admitting patients due to its current constraints. Management of the hospital is hoping the visit by the Health Minister, Lex Segbefia, would yield a positive result.
And joining us on the phone now is Tony Goodman, who is the Public Relations Officer of the Ministry of Health. Tony, good evening. And what has brought the Accra Psychiatric Hospital to this level? Hello, Tony.
Good evening.
Yes, good evening, Tony. I'm asking what has brought the Accra Psychiatric Hospital to this situation?
Yeah, thank you very much. Let me say good evening to our viewers. Let me answer your question just this way.
Right.
It's because you have a lot of patients coming in, and our projection or the hospital's projection failed. That is why.
Is the patients coming, the number, is it unexpected?
Okay, now let me explain. We propose a budget, or the hospital proposed a budget for a particular year. Year in, year out, they don't get, they get their budget, they're not able to meet their demand because the amount that goes in, they pay their suppliers, but they still owe some of them. The amount of money we are talking about is spanned from 2012 to date. So they've been in arrears for 4 years. So it's not just this year. They started 4 years ago. You project maybe 4,000. At the end of the day, you spend 6,000. Your suppliers will continue supplying you. You have a special arrangement with them that will pay you. You just continue supplying us. But this time around, the suppliers are saying, we will not supply you again. So what we did as a ministry was to call these suppliers into the minister's office. He spoke to them and assured them that he's going to make some money available to the psychiatric hospital so that at least some of the debt can be paid. So Thursday, the minister went to the Accra Psychiatric Hospital